Hey everybody, it's Chris. Got another great interview for you today. This is going to be super fascinating. I'm really excited to talk to Dr. David Hanscom. David Hanscom, medical doctor, wrote this book, Do You Really Need Spine Surgery? And Dr. Hanscom is the second medical doctor I've interviewed who was a spine surgeon that actually tries to talk his patients out of spine surgery. And I'm really, really fascinated to dig into this because this is kind of a personal, funny anecdote, but a lot of people have seen this movie, Dr. Death, right? Either they listened to the podcast or they watched the series online, and that's about a doctor named Christopher Dunch, who was this sort of horrific spine surgeon in Texas that is now in jail because he killed people and he was just that bad. And they still don't know if it was intentional or just gross malpractice. It's hard to tell, but the guy was a bad dude. We went to the same high school. Yeah, same high school. He's I think 4 years older than me. So yeah, strange connection there. But anyway, Dr. Hanscom, thanks for taking the time to do this.
Thank you, Chris. I'm excited to be here. And this is going to be a tricky topic for me because I try to see the solution side, but unfortunately, the doctor's death story is extreme, but probably 80% of spine surgery should not be done. And if you go through a procedure that shouldn't be done, you're at risk. And I finally quit my practice in 2019 to do what I'm doing full time. And it turns out we're doing spine surgery on anxiety, and it doesn't work. And it turns out most symptoms in the body are based on the body's physiology. And let me define physiology for a second. Is how your body runs. In other words, you have a car, and we turn the car on. That's, quote, the physiology of the car, right? The spark plugs, the timing, how it runs, et cetera. And the body functions much more complicated, of course, but your blood pressure, your acid-base balance, your electrolytes, all these things are monitored by your body. So it's the actual way the body runs is called physiology. 90% of the symptoms in the body are from the physiology, and only 10% are structural. Whereas in medicine right now, we're working about 90% structural, and we're really hurting people. So I was finally seeing 3 to 5 patients a week. Again, not Dr. Death, but not that far off, where they're having these big operations done with complications that were destroying their lives. And I just heard of one case this weekend from the East Coast. I did not see the patient personally, but 2 of my friends were trying to salvage her situation. She's 26 years old with a normal 26-year-old spine. Some surgeon decided to fuse it from her skull to her pelvis.
Whoa.
26 years old. And we know that pain in the back pain and neck pain, we'll talk about this a little bit later in the show, is in the muscles, the tendons, the ligaments. And there's nothing in medicine, in our anatomy, any part of our training that says taking a normal spine and creating this mass of scar tissue and bone with rods in place makes any sense at all. There's no data to support even a 1-level fusion for back pain. So the success rate of a 1-level fusion for back pain is about 22%.
When you say 1 level, that's just fusing 2 vertebrae together?
Correct. Welding 2 vertebrae together. So what a fusion is, we create a temporary bridge with screws in place to hold it still. And then the body, we lay in bone graft, which forms a bridge of bone between the 2 vertebrae, which makes a solid piece of bone. So if the bone doesn't heal, the hardware will eventually break. So the hardware is temporary because bone will not form if there's motion. So we're very good at obtaining fusions. But remember, bone spurs, arthritis, disc degeneration, herniated disc, bulging disc, none of those are a source of pain. They've been well documented to not be a source of pain. So the better terms that are being degenerative disc disease would be a normally aging spine. So we're doing over $20 billion a year of spine surgery on normally aging spines.
And how many people does that represent?
Over 500,000 a year. So I estimate over the last 10 years, we have over 5 million people with operations that have about a 20 to 30% success rate. So if you're one of those people that got better, great. I'm excited for you. But remember, the placebo response, which is actually a very powerful healing response, is about 20 to 40%. So this is actually worse than placebo. And if you use tools that honor the body's physiology, you heal. People heal. So this 26-year-old girl could have easily, classically, done just fine and had a normal life. So now she's like a tree. She can't tilt her chin. She can't rotate her head. Her neck is welded to her pelvis. And then on top of that, in her neck, what happens is that is called internal wound dehiscence. So it's called the fascial layer is actually pulled apart. The skin, she has a big concavity in the back of her neck. And so now, in addition, she has a web neck.
What does that mean?
So the skin gets plastered to the spine. So there's sort of like a hole in the back of her neck. I mean, there's skin that covers it, but there's no muscles or tissues over this spine. So then the tissues on the side of her neck pulled out to the side. And so the muscles are on the side of her neck is like a web. It's like a web feet. So she's 26.
That's tragic.
And somebody, but see what happened, instead of doing 1 and 2 level fusions that didn't work, I'm now seeing 8, 10, 12, 14 level fusions that don't work. And the complication rate of these operations is horrendous, over 70%. The success rate is 20% or less. Then what finally got me to quit is that I was seeing patients, dozens and dozens, now actually hundreds of patients go to pain-free with minimal risk, minimal cost, self-directed. So I'm watching these people go to pain-free, and I'm watching people actively being hurt with spine surgery. And then the downside of a failed spine surgery is just catastrophic a lot of the time. So again, the success rate of doing a back fusion for back pain is about 22%. There's not one research paper in 60 years that says that a spine surgery works. Not one.
That's I've been studying health and nutrition and holistic healing for 17 years, and I know there's a lot of unnecessary surgeries happening, but that is shockingly horrific. 80% of spine surgeries, and spine surgery freaks me out. Like I understand you've got your entire hub of your nervous system in there, your spinal cord, right? Paralysis is a serious risk when you're cutting around those, anywhere around your spine. So how did you come to this conclusion? Because you're not a fresh young med student out of med school. This was your career for, I'm assuming, at least several decades. What was the progressive revelation that happened in your professional life, I guess I could say, that finally led you to say, like, enough, like I can't do this anymore?
Well, first of all, I was one of those surgeons who did fusions for back pain. I did that for 7 years, and I came out with a zeal. I was excited about it. I was really going to help people. And I also did not think there were alternatives. So I felt like I was the end of the line. I felt guilty if I did not do it for a surgery. And my success rate is a little higher than 20%. I think it's like 45%, but it wasn't very good. Then the data came out in 1993 that the success rate of a spine fusion for back pain in the state of Washington workers' comp system was 15% at 1 year and 22% at 2 years. So I stopped because no data had really been coming out. And then what happened, different instrumentation procedures came out and the volume of spine surgery went up, not down, based on that data. So the data shows that only 10% of surgeons are actually acknowledging the data of optimizing surgical outcomes before they do the surgery. So what happened to me right about that time that I quit doing spine fusions, I developed severe chronic pain myself. So I went into a 13-year tailspin. Some people would call it burnout. We can talk about this a little bit later, but remember, most symptoms are based on the body's chemistry. So if you're in fight or flight, your nervous system is fired up, which also includes the immune system. And so it starts destroying your tissues. So there's over 30 symptoms of a fired up fight or flight nervous system. I had 17 of them at the same time.
What are some of those symptoms? By the way, my audience is very familiar with this because we talk about it all the time: stress suppressing immunity and promoting inflammation and leading to a hospitable environment for cancer.
Right.
and other chronic disease. But yeah, what are some of these symptoms that are hallmarks of high stress?
So first of all, let me say we sort of consider stress a psychological construct, right? Right.
Yes.
Okay.
Yes.
Do you mind if I digress here just for a second? Because
Yeah,
this
please.
is my message I'm trying to get to the world. So,
But I believe it's also physiological. I mean, the way I talk about it, it
no,
starts
I
in
know
your
you do,
mind and
but
translates to your body.
right. But most people feel that if you're feeling stressed out, that somehow you're inadequate, you should be tougher, et cetera. I mean, at least in medicine, we're taught to be tough. And I think in society, quit complaining, just do your job, et cetera. So we tend to suppress stress. So here's the concept I've come up with called dynamic healing. So when your stresses overwhelm your coping capacity or your nervous system, your body goes into fight or flight. That's what it's supposed to do because your stresses are saying danger. Your body, your brain is absorbing all the input, and you develop symptoms based on your body's physiology. So what happens is that you call it stresses. I'm going to use the word threat instead of the word stress. But stress isn't the problem as much as the physiological response to the stress. So the physiology is fight or flight. You're consuming resources. Your glucose levels are up because of cortisol. And you're robbing glucose from your brain cells, from your tendons, your ligaments. You're breaking down your body. So you have early degeneration. You have inflammation of the brain. And what I hadn't remembered from medical school, which now seems painfully obvious to me, is that fight or flight response includes the immune system. So what happens is that we need fight or flight to survive, that we would not be here. So fight or flight is a gift. And so the problem is when it is sustained, it starts destroying your own tissues. So it turns out that all chronic disease, and this is what we've been finding out the last 5 years. When I say been finding out, it's actually been in the literature for over 30 years, that the neuroscience is extremely deep, that social factors affect your immune system. So the number one factor, so it's chronic stress is the problem. In other words, sustained exposure to threat physiology, I'm going to call it threat physiology, is the problem. So with dynamic healing, you have your stresses or circumstances and your coping skills that create symptoms. Well, in medicine, we're treating just the symptoms, right? So we haven't done anything. We've treated the symptoms, which work a little bit, but you're going home to do a difficult job or an abusive spouse or whatever, that's your stresses. In medicine now, we don't have time to talk to a patient, so we don't know your circumstances. We don't know you as a person, so we don't know your coping skills. And so you're in threat physiology, we treat symptoms, and the problem keeps going. So it turns out that chronic stress, it turns out that anxiety, depression, bipolar, obsessive compulsive disorder, and schizophrenia, by the way, are inflammatory disorders. It also turns out that Alzheimer's, Parkinson's, cardiac disease, peripheral vascular disease, hypertension, obesity are all inflammatory disorders. Well, we also know that probably you take autoimmune disorders, which are clearly inflammatory, but also cancer, et cetera, are all from a compromised immune system. So the key is there's a bunch of ways of attacking the problem. So with dynamic healing, you get to understand the person's stresses. And I can't solve your stresses, but I can at least acknowledge that they're there. And we can give you tools to train your brain to actually process stress differently, because you can't avoid stress. That's not life. And then with your nervous system, you can increase the resiliency of it. So if your nervous system can be either calm or hyperactive, if your nervous system is hyperactive, it takes less stress to set off that fight or flight response. So remember, the main goal I would like to give the audience today is that as you calm down the body's physiology, symptoms resolve. So you want to minimize your time in fight or flight. That's the essence of the solution. And you want to maximize your time in safety. And of course, most of the time we're in between. Where's energy in, energy out. And the term for that is called homeostasis, where you're just driving your car down the freeway in fifth gear, just cruising along. So it's energy in, energy out. But in fight or flight, you're consuming resources. You cannot heal in fight or flight. Cannot do it, right? By definition. So then when it's sustained, people get sick. So that's my main message, is that your body is a unit. If you just picture a Boeing jet, how can you fly that jet without a computer? Can't do it, right? So the jet's bringing in sensory data from the gas gauge, altimeter, wind speed, all these different things come into the computer that gets analyzed, and the computer sends out signals to the jet to fly this jet. Your brain, same thing in your body. Your brain has eyes, ears, et cetera, all these sensors throughout your body that bring in all this input, and then they make adjustments by the second or millisecond to keep you alive. Acid base balance, your blood flow, your blood pressure, all these things are adjusted every second is how we stay alive. It's automatic. So when you're in fight or flight, your body's on high alert. And the word that humans use, which my cat has the same response, but she doesn't have language. So humans use the word, is called anxiety. So anxiety is a result of a threat. It's not the cause. And so I'm part of a work group that meets twice a month, and we are trying to get rid of the word anxiety. It's the driving force that creates all sorts of behaviors to avoid it. But anxiety is a necessary survival tool because without it, you wouldn't survive. The species of creatures who don't pay attention to threats didn't survive. So we're survival of the fittest, but also survival of the most anxious. The sensation is intended to be so unpleasant that it forces you to take action, right? So anxiety is unpleasant, but it just reflects the state of your body's chemistry. The key issue here is that for humans, we have language that makes it more complicated in that thoughts, unpleasant thoughts, create the same chemical reaction as a physical threat. But humans cannot escape their thoughts, right? So that's what creates a sustained fight or flight response is our consciousness. So, and what's even worse is that repressed unpleasant thoughts are even more of a stimulus than expressed. So every human being has this problem to some degree. We all have anxiety. It's an automatic, hardwired survival response. The unconscious brain, of which this automatic response is, processes about 20 million bits of information per second. The conscious brain processes 40, 20 million versus 40. So we spend a tremendous amount of life energy trying to compensate for this unpleasant feeling. We take it personally, but it's an automatic, hardwired survival response. So you might as well be talking to the hard drive of your computer. Or as my friend Bruce Lipton says, you might as well take the hood of your car, lift it up, and talk to your engine. So it's going to be there no matter what. It's extremely powerful compared to your conscious brain. And we can talk about the solution in a second, but the essence of the solution is you separate your identity from the survival reaction, which is intended to be amoral, unpleasant, not part of your identity, not part of not part of who you are. And so once you understand it's a gift, it keeps you alive, but it's not your identity, things start to change relatively quickly. So the term is dynamic healing. So we allow you to process stress more efficiently. We increase the resiliency of your nervous system, which, by the way, is diet, exercise, and sleep. And then there's ways of actually directly lowering the threat physiology so you're not stuck there. So there's 3 different intervention points, and each person develops their own way of actually addressing any one of those 3 on a given moment. So if you're a little bit higher, if you're a little bit hyper and wired, you can use some breath work to drop down the body's chemistry. So I just want to go back to one specific question you asked that as you know, if I segue here a little bit. So if I go too far off track, please stop me. But I had 17 of these over 30 symptoms: migraine headaches, tinnitus or ringing in my ears, stomach issues, back pain, neck pain. I had burning in my feet. These skin rashes were popping up over my entire body. And then what happened, I went from being a fearless surgeon to crippling anxiety. I had a panic attack. And a panic attack is just an autonomic nervous system flood of chemicals, adrenaline, cortisol. So your heart races, you're sweating. I thought I was going to die. And that was the first of many panic attacks over the next several years. So I went from a fearless surgeon, honestly, I did not know what anxiety was, to crippling anxiety in a day. And then I thought anxiety was psychological. So I actually went into psychotherapy to solve this thing. And it turns out it's physiological. And again, it's a complete mismatch of the unconscious versus conscious brain. And to change the unconscious brain, you have to program it, reprogram it. You can't reason with it. It's not rational, but you can start reprogramming it. And that's a different conversation. So I had over 17 of these symptoms at the same time. And again, mental pain and physical pain are processed the same way. So as I finally by accident learned how to regulate my nervous system, again, I only figured out what I was doing later. So I sort of, stumbled through all of this stuff. So I wrote a book called Back in Control, A Surgeon's Roadmap Out of Chronic Pain in 2012. The second edition was 2015. I now developed what's called the DLC Journey, the Direct Your Own Care Journey, which is a computer-based program that now acknowledges the consistent sequence that people take to learn the tools to minimize their threat physiology. So the book Back in Control is a great background book, but now I understand the input versus the nervous system. And so again, medicine is treating only the symptoms. So the term I have for medicine now, and I'm serious about this, is disintegrated medicine. Right? I mean, integrated medicine is acknowledges your circumstances, finds out who you are, and again, doesn't fix you, but allows you to fix yourself, which you obviously did. And so what you did is not out there. And so modern medicine is ignoring the data. And this work group we're on really has lots of thoughts about cancer, by the way, is that under sustained fight or flight, your body breaks down. I've had several friends die of cancer. Every one of them was under extreme stress when the cancer hit. And I don't know about your story, but I'm guessing that was somewhat the same thing, that when you had the cancer, your stress points were high, or what, is that a correct statement for you?
I mean, every cancer patient you ever talk to and you ask them, why do you think you got cancer? Stress is almost the first answer that you get from everyone. And I was 26. I was very young. I wasn't in that. There's a bit of a cancer profile that didn't fit me exactly, which is I was young and didn't have a bunch of hardship in life, but I was, type A. I was building a real estate business. It was very stressful, and I was very driven. But I also had a lot of, insecurities and unresolved negative emotions and unforgiveness in my life. And I was prideful, so I had a lot of swirling negative thought patterns and emotions, and I was really competitive. And, after years of introspection, I sort of figured out, okay, here's everything I was doing wrong. So stress was definitely a big part of my life. Yeah. Right.
So the main thing, I think you've probably already conveyed this to your audience, but your body, you cannot fly a Boeing jet without a computer, right? So you're not going to run your nervous system. You cannot run your body without a brain. It's a central control tower. And so the Boeing jet has about 2 million parts. The human body has about 30 trillion cells. So it's all integrated. So I don't use the word mind body so much anymore because it implies there's a separation in the first place, and it's completely intertwined. It's a unit response to the world. So we have language that unfortunately, or fortunately, depends how you look at it, creates the exact same response in your body as a physical threat. But since you can't escape your thoughts, it's a sustained threat. So the key issue for disease, again, all chronic disease, physical and mental, is based on ongoing metabolism and inflammation in a heightened central nervous system. So you can't control your thoughts, but you have a lot to say about your physiology. And I'm guessing, I don't know your program, but I'm guessing you found your own way to actually calm your body's physiology down and move your brain forward. And so it's very consistent, it's very doable. The Direct Your Own Care Journey is a subscription service. It offers a sequence of lessons with videos, questions and answers, because it's a huge paradigm shift, because you can't fix yourself. Because where's the problem? It's on you. It actually makes the problem worse. So after 13 years of psychotherapy, for me, I got way worse, more symptoms.
13 years of psychotherapy.
Yep.
Oh, man.
I thought it was psychological. I was trying.
Yeah.
I was desperate, right? And nobody could tell me what was going on. And they estimate, there's 2 papers out that show that your quality of life of having chronic pain is equivalent to having terminal cancer. Except when you read the papers carefully, it's actually worse, because at least with terminal cancer, you know the diagnosis. Not great, but you have a diagnosis. With chronic pain, nobody could tell me what was going on. So I am I had the same personality you did. I mean, I became a major spine surgeon, and my badge of honor was I'm just tough. Really tough.
Yeah, me too.
And so what happens, I was an expert at suppressing everything. And but actually, my migraine started when I was 5. My feet started to burn when I was about 30, and my ears started to ring. And it wasn't till about 10 years later that I actually developed this crippling anxiety. So I was actually getting sick sooner, but I wasn't acknowledging what it was. I just blew it off, right? Just another whatever. So here I am at the peak of my career, nice practice, great kid, beautiful house. And I was miserable, really miserable. And I came out of it by accident. So again, I don't want to throw my colleagues under the bus because none of us are trained correctly. I was an enthusiastic spine surgeon. Nobody taught me otherwise. And what's disturbing to me now is that the data has been there for over 50 years about exactly what's going on. Have you heard of the Holmes scale by chance?
I have not.
So if you look at it, it's called, I think it's stress.com. Just look it up on the internet, Holmes, HOLMES dash Rahe, RAHE. So it's a scale that simply rates life events. And if you have more than 300 points on the scale, you have an 80% chance of a major illness within 2 years. And there's paper after paper after paper that says stress kills. But again, for some reason, medicine has not honored what we learned in medical school. I think it's even in high school that under stress, your body goes into fight or flight. So it's a physiological. So we tend to think stress is psychological, or if the doctors don't see anything wrong in a test, why they'll say, well, this is psychological. It is not psychological. It is physiological. So these stresses or your circumstances, I'll use the word threat again, translates into physiology, which translates into disease. And that's where you cannot control your thoughts. You cannot control most of your stresses, but you can process the stresses differently. You can increase the resiliency of your nervous system. And then there's ways of directly altering your body's physiology.
This is a lot. This is really awesome. And a lot of the things that I learned over the years about the subconscious mind running constantly in the background, like your computer, like a computer program, and your conscious mind being what's on the screen in front of you, and your subconscious is everything else running in the background, and having a lot of unresolved conflict or emotional issues and unhealthy thought patterns and beliefs. All that stuff is just running constantly.
Right.
And even if you're distracted. And so this, one thing I talk about a lot with my audience is that stress being a major root cause of most chronic disease, because it also leads us to self-medicate in ways that are, most of them very, very unhealthy: overeating, drug use, alcohol, tobacco, right? And so it becomes a vicious cycle of, you have this high level state of stress and you're constantly seeking ways to medicate it subconsciously. And then it just, over time, you just sort of spiral down.
Right.
What are some of the practical techniques that you find are really, really helpful for someone to, I understand this is not a problem that can be solved in one day. Like, you really have to work through some changing the way you think, the way you process stress, being aware of stress when it's happening to you, like all these things. But what are some of the tools that you've found to be the most useful?
So let me make one comment. So once people understand that anxiety is a result of stress, not the cause, they understand it simply is a reflection of the state of your body's chemistry, then the changes can occur very quickly within weeks. This is not a lot of quote work. So what you're doing is that, again, with the DOC journey, I urge people not to rush through it. It's like trying to learn golf. You're not going to learn golf by reading a book, right? Tiger Woods did not learn how to play golf by reading a book. He practiced. So the unconscious brain is hardwired, and we become geniuses at feeling pain. That's our default survival mode. We're not geniuses at enjoying our life, because the human brain has one function, and that's to survive. And you go into rest phases just because you have to survive, but the key issue is survival. Human consciousness came along late, and so we had the capacity to play and give back and have a good time, but that's not our default mode. So the key issue here is that, first of all, understanding the nature of the problem is number one. So education. And so the solution lies in what's called neuroplasticity, where your brain changes every second. So when you talk about the unconscious brain, is that, again, 20 million bits of information per second. So if I look at that light, my pupils constrict. As I talk to you, my jaw muscles are moving automatically. If a dog jumps at me, I'm going to jump back automatically. I look at my cat jump a 6-foot fence. Why? The brain, she doesn't have consciousness about figuring out what muscles to use to jump on that fence. I'm not figuring which muscles I'm using to walk. So the unconscious brain is incredible about keeping us alive. So to change that takes repetition. So the first step is to separate this thing we call anxiety and make it empirical, and get rid of the word anxiety and just use the word activated nervous system. And just visualize a large thermometer on the opposite wall. Is that the anxiety the level of that thermometer represents the level of your anxiety. Let me say one quick thing here. So if you're anxious, you're compelled to do something to solve the problem, right? Otherwise, you don't survive. There's no rewards in nature for being vulnerable. So, but the problem with humans is the essence of relationships is being vulnerable. Huge problem there. So I'm going to ask you a question that is not intended to be answered, but I'm going to ask a question. It's not a trick question, but I just want people to understand this. So, let me just finish one comment here. So something causes anxiety or causes an activated nervous system, and you avoid the problem and you move on. What happens if you're trapped and you can't solve the problem? What happens next?
Well, then the nature example is you have to fight.
Right.
To fight your way out of it.
So you get angry.
Or struggle. Yeah.
Right? Okay. So anger and anxiety are the same thing. So anger is a more intense reaction. So the wordplay is alert, nervous, afraid, angry, paranoid, and terrorized. I mean, there's different levels of this thermometer going up. So you visualize a large thermometer and represents this is what you have. It's not who you are. It's a gift. So the question, sort of a rhetorical question, it's not responsive to rational interventions. How do you decrease anxiety?
So you're asking what my personal practice is?
Well, I'll just cut to the question.
Well, because I'm happy to answer, and I'd love to hear what you think.
Well, yeah, but here's the thing: there's lots of hows. That's what people jump to. But the bottom line is, no matter how you do it, and you have your tools, I have mine, you simply lower the levels of the stress chemicals. So you can't control your thoughts, but there's lots of things you can do to lower the physiology. So people keep trying to use rational means to deal with anxiety. And I'm guessing, I know the tools that you use are designed to lower stress chemicals, but the bottom line, no matter how you do it, as you intervene with the input, the nervous system, and the output, once you learn how and why you're using the tools, the bottom line is you simply lower that thermometer. So that's number one. Secondly, as far as interventions, let's talk about the output. So your body, say you're upset about something, somebody hurt your feelings, or you were injured on the job, or somebody cut you off in traffic. So your stress chemicals are up, right? So that's an inflammatory response, as well as adrenaline and cortisol. So are you familiar with the polyvagal theory?
No.
By chance? Okay. So Dr. Stephen Porges out of Florida, and he's somebody you would love to interview, and his wife, Sue Carter, is also an expert in this, is that the vagus nerve goes to every internal organ in the body. So it's called the autonomic nervous system because it's automatic. So there's a sympathetic nervous system that activates you, then the parasympathetic nervous system calms you down. So essentially, most of the parasympathetic nervous system is through the vagus nerve, which is the 10th cranial nerve. So when we say cranial nerves, these are nerves that come right off the brainstem, just below the major part of the brain. So there's ways of stimulating the vagus nerve that's incredibly anti-inflammatory. It's the parasympathetic nervous system. So the most powerful part of the body in which you, again, I'd love to know you. I'm going to have you on my podcast. I want to hear your story because I want to know what you did, because you'll find out what you did, calm down your body's physiology. So if you're activated and you're in fight or flight, as you stimulate the vagus nerve, which is anti-inflammatory, you go into safety. So there's all sorts of ways of developing cues of safety that when you're in fight or flight, there's adrenaline, cortisol, inflammatory proteins called cytokines, noradrenaline, excitatory neurotransmitters. So you're on high alert, right? So in safety, there's oxytocin, dopamine, serotonin, the GABA drugs, and anti-inflammatory cytokines. So what you want to do is you want to stimulate your parasympathetic nervous system to counteract your sympathetic nervous system. Medications don't do that. And what you did in healing yourself is you started to recruit to your parasympathetic nervous system, which is healing. So again, a sustained fight or flight, by definition, you can't heal. So for instance, breath work, slow breathing, alternate nostril breathing, slow breaths in, breaths out, directly stimulates the vagus nerve. Humming stimulates the seventh cranial nerve at the back of your throat, which is next to the vagus nerve. So humming directly is anti-inflammatory. Rubbing your forehead stimulates the fifth cranial nerve, again, the vagus nerve. And then the other one is sounds. There's music sort of in the pitch of lullabies. It's very calming. And so what you're doing when you're doing these tools, you're directly stimulating the vagus nerve, which is directly lowering the threat response. So that's I call it the output. Remember, there's the input nervous system and the output. So I want to go to a tool that you probably use a lot of, mindfulness. I'm assuming it's one of your tools. So what you're doing with mindfulness, and I have one tool myself called active meditation, is that you have these racing thoughts, you're upset, you're wired. So what you're doing with mindfulness, you're switching your sensory input from thoughts to a different sensation. So just drop your shoulders for a second. Let your jaw muscles relax. It's about 3 to 5 seconds during the day. You simply switch sensory input. So instead of doing battle with these thoughts, which reinforces them, you simply switch sensory input. So when you do mindfulness meditation type work, you're changing the input. Another method of changing input, because again, if you change the input, it lowers the threat physiology. So we talked about diet, anti-inflammatory diet increases the reactive. So when you're in fight or flight, your brain throws off what's called inflammatory cytokines. You have excitatory nervous system with neurotransmitters. So your brain itself is sensitized. Your brain's on fire. Again, not psychological, but your glial cells are throwing off these inflammatory cytokines and your brain is inflamed. So what you're doing when you do these vagus nerve interventions, you're actually calming down the reactivity of your nervous system also. But an anti-inflammatory diet lowers the reactivity of your brain. Exercise and sleep all lower your inflammatory response. So what you've done, you've indirectly now lowered the fight or flight response. And so the tools don't directly lower the fight or flight response, but as you lower the reactivity of the nervous system, then you have more stress required to actually kick off the response. So I'll just say it probably just one more time, is that the essence of healing is minimizing your time in fight or flight. It is necessary. It's a gift, but you don't want to stay in that state. So again, if you look at diet, exercise, and sleep as methods to increase the nervous system, then when you know why you're doing it, people say, well, I tried an anti-inflammatory diet and it didn't work. Well, guess what? It's just one part of that cascade. So, but if you're trying to get sleep and eating the worst diet possible, right, that doesn't really help. So mindfulness by itself isn't going to help if your nervous system's too fired up. So you start combining mindfulness with better diet and exercise, and you use some of these techniques to lower your physiology, it's game on, right? So again, as you lower your stress chemicals, the sensation that we call anxiety starts to drop down. And so you learn tools to actually lower your physiology. If you try to suppress stress or work through it, you actually fire it back up. But the 3 core concepts that start the process is, number one, is called expressive writing. Have you heard of this?
I have, but please.
So after my 15 years in chronic pain, I happened to pick up this book that said to start writing. So I started writing down my thoughts, expression on paper. Turned out there's over 1,200 research projects, 1,200 research papers that document that expressive writing changes the body's chemistry. Lower viral loads, better wound healing, lower inflammation, lowers symptoms of autoimmune disorders. It's unbelievable. You simply write down your thoughts and you tear them up. It's called expressive writing. And so what you're doing, you can't escape your thoughts, which is probably the cause of most chronic pain and abnormal physiology, but it's just a separation exercise. So your thoughts are here, You have a distance between you and your thoughts, and then you tear them up. But you're not tearing them up. You're not tearing them up to get rid of them. I mean, there's trillions of thoughts. So you're just simply separating. It's just an exercise. And you're tearing them up for two reasons. So it turns out that the more intense the thoughts you can get on paper, the better. So you want to write with absolute freedom. You have to tear them up, not crumple them up. Some people shred them or burn them. The second thing is, which is actually more important in my mind, is that when you do this writing, all these issues come up, right? They're not issues, they're thoughts. So if you want to analyze and sort of work on these things, why you're actually reinforcing those circuits. So you're tearing them up to not analyze them. So it's just a separation exercise. You start taking your identity away from these thoughts. And then so for whatever, and there's a long story behind this, but the only mandatory first step in this whole process is the expressive writing. Huge.
And it's basically just releasing your thoughts in a sense, right? You're like taking them out of your brain, putting them on a physical form.
Right.
Yeah. And then I imagine the shredding or burning or tearing is probably also gives you some sense of relief that no one would accidentally read it.
Right. Absolutely.
If you just crumpled it up, someone could uncrumple it, right?
Right. But the key issue is here that the thoughts are always going to be there. Again, you're not, see, the people want to say, well, I'm sort of doing a catharsis that I've solved this, gone, solved this, gone. These are permanent embedded patterns. So it's just a separation. It's a metaphor in a way. Again, there's trillions of thoughts, and you just write down a couple, but you've separated. Mm-hmm. So the expressive, the first step is actually understanding the problem, which we've talked a little bit about today. The second one is expressive writing. The third thing is what we just did with this active meditation, that when you do expressive writing, you have again changed the input. So instead of the thoughts creating this physiological reaction, you've now separated, so you change the input. So you have the expressive writing and the mindfulness, which change the input.
And how long, let me just interrupt. How long should an expressive writing session take? What's it? 5 minutes?
As short as 30 seconds.
Got it.
5 minutes. I mean, usually when I was really bad shape. I mean, I had a flat out suicidal depression, extreme anxiety. I developed a full-blown obsessive compulsive disorder, which is manifested by extreme intrusive thoughts, almost visual. So I would write for hours because I had no place else to go. But I encourage people to write once or twice a day, 5, 10, 15 minutes. And when you start, write a lot. But the basic thing is please tear them up. And one of my pain colleagues pointed out that if people choose to hold on to their thoughts, they're choosing to hold on to their pain. It's an odd thing because people want to analyze and figure these things out. But there's two parts to healing, which we'll get to in a second. So there's the expressive writing, the active meditation, education, the writing, the active meditation, and then sleep is huge. So there's a study out of Israel that shows that lack of sleep actually causes chronic low back pain. It's not the other way around. So sleep's a big deal. And again, it's inflammatory, not sleeping, makes a big difference. And then the final thing, which turned out to be almost as powerful as expressive writing, is that the solution to the problem is neuroplasticity. You're developing your brain where you want it to go. In other words, you don't try to solve chronic pain because your problem's on your attention's on the problem, not the solution. But people in pain, mental and physical, tend to complain. They discuss their medical care. They discuss their pain. They'll complain. They'll gossip. They'll give advice. Your attention's in a negative spot. You're actually reinforcing the circuits. So let's pretend you're in my office.
Let me interrupt you on this topic. Is complaining in some sense, I mean, obviously, I think most people agree it's not good, but is it in some sense kind of like a pressure relief valve? And what I mean by that is complaining in a binary way better than holding in and bottling up your feelings?
No.
Okay.
I'll explain why in a second. So it sounds like, I mean, it feels good. It's seductive. I did it for 15 years. I mean, I'm really good at this. And it's sort of a joke, but not so much of a joke. Surgeons are really good at complaining. I'm really good at this. That's what the piece of paper is for, right? So when I say expressive writing, you can go into a room and verbalize your thoughts. So somehow you're simply externalizing your thoughts is the key here. So get it out on a piece of paper. But it's the problem if you and I are talking about our pain and complaining about politics, religion, whatever it is, we're bonding, but it's a negative bonding, and we're really, really reinforcing the circuits in a negative direction. So what you're trying to do is creating a new nervous system. So there's two parts of healing. One of them is if you use the tools like mindfulness, meditation, exercise, diet, empirically to deal with this inevitable anxiety and frustration, which is life, but you want to minimize your time and threat physiology. So you don't want to suppress the reaction, but you become aware, okay, I'm anxious and frustrated. Then you make a choice, how long do I want to stay there? And then you make a choice to use the tools to move on, right? So that's a very empirical process.
And that's the way I operate, exactly
right.
like that. I recognize when I feel stressed or anxious or fearful or frustrated, I consciously notice, and then I sort of talk myself out of it. I sort of say, okay, I'm not going to let this ruin my morning or my day. And let me just step back and take stock of my life. I usually practice gratitude and count my blessings. And then I realize, like, you know what, this just isn't a big deal after all.
Yeah. Well, again, that's what you're doing. So you're training your brain to, it's like learning a new language. So you're not going to learn French by trying to fix your English, and you're not going to solve your life. The default language is pain and signals of danger. So you don't solve chronic pain because your attention is on the problem, not the solution. So you did exactly what I would recommend you do. It's awareness, then you separate, and then you redirect. So that stimulates neuroplasticity. And so that's exactly correct. So with repetition, you start developing a new nervous system. So remember, you can't correct your brain or fix it, but you can reconstruct it, and you're going in a different direction. So it's like installing a virtual desktop on your computer. You now have a nervous system that actually functions quite well because you programmed it that way. So the unconscious brain is not responsive to rational interventions, but you can reprogram it. So what you did is a classic reprogramming tool. But if you're complaining, discussing medical care, gossiping, etc., where's your attention? You're programming it the wrong direction. And it's sort of hard. So I say, Chris, when you leave my office, when you walk out that door, you will never discuss your pain ever again with anybody except your medical providers. You're not going to discuss your medical care with friends or colleagues. It's just with your doctors or providers. But also, since mental pain is a problem, that means no complaining, no gossiping, no being critical, no giving unasked for advice, just listen. And it's sort of hard. But I'll tell you, within a couple of weeks, when people come back, between the expressive writing, the active meditation, and not discussing their pain, it's just absolutely game on because you're reconstructing your brain. So again, not psychological because you're changing the physical structure of your brain. Again, it's neuroplasticity. When I was in medical school, we thought that the brain was static, that just shrunk as you get older. We now know the brain is physiological. It changes every millisecond. So just as we've talked, if there's new concepts in your mind, something changed. Your brain developed new connections and new neurons. So you're inducing physical changes in your nervous system. So with repetition, that becomes more of a habit than just complaining. But I'll tell you, it's interesting. We've done a bunch of workshops, and people think they're going to the workshop to really analyze their pain, really discuss it. And we will not let people discuss their pain at all. And people don't know what to do because you actually become your pain, right?
Because they want to tell you all their problems.
Right.
Yeah.
The other thing I also point out, if you go to a party and people in their 20s, early 30s, it's sort of a lot of energy about what's possible and sort of excitement. But you go to the same party when people in their 60s and 70s were complaining. It's a different energy, right?
Mm-hmm. Yeah.
You see, all these factors become more intense with age and repetition. So again, we become geniuses at feeling pain. We're not geniuses at enjoying our life. So in summary, the basic thing is all these tools we talked about are just empirically shut the door, done. And anxiety and frustration are always going to be there. You're not going to try to solve them, fix them. You get to feel them and then just move on. Exactly what you just said. And then the solution to chronic pain, mental or physical, it's not positive thinking, but it's a positive vision. What do you want your life to look like? So giving back, community, friends, family, the spiritual journey, all those things move your brain. Play. When you're at play, your body chemistry is really optimized. but you're not doing these things to compensate for the negativity because it's a mismatch. So as you shut the door on the unconscious automatic survival circuits multiple times a day, and you keep working towards what you want, that's where the healing occurs. As you move away from the pain circuits, your pain circuits atrophy, and they aren't as powerful, and you aren't triggered as often, and you don't have to use the tools as much. But you also become very skilled at using the tools. So I've now switched gears a lot. I don't ask people anymore to really find out, I was triggered because my mother did this or this, and this. Again, every second you spend looking backwards, you're not here. So the idea is to become very skilled at using the tools to process anxiety and anger. Then if you want to call it work, your work is developing the life that you want. And I'm guessing I'm anxious to have you on my podcast because I'm really curious how you figured this out, because it worked. In other words, everybody does it their own way. That's why it's called the Direct Your Own Care Journey. So the key issue is to find out that the process gives people the framework to understand the problem. And then as you keep searching and moving forward, it's your responsibility to figure it out, not me. And you'll figure it out. The human body wants to heal. So you did it, which I'm pretty excited about. And again, it's a whole different conversation because we've written 3 major papers on COVID. And we wrote what's called Plan A, which I will give to you. But there's 12 categories of things you can do to lower inflammatory markers. And so, again, not psychological, all alternate. You can't control your thoughts, but you have a lot to say over your body's physiology and inflammatory markers. So you'll resonate with this really well. But I'm really curious to find out your story, how you figured this out, and actually what you did. Because each person that gets better, and we have hundreds of people coming out of the hole here, is very self-directed. It's not very hard, by the way. It just takes repetition and programming. So that's, yeah.
Okay, so I want to push back on something you've said a couple times because I really want to know why we have a difference of opinion on it, and that is when you say you can't control your thoughts. I feel like I can, and I'll explain why. So if someone, let's say I'm in traffic and someone cuts me off, and my first thought is like, "What a jerk!" Right? Like this person is the worst. Right? Those are my thoughts.
Right.
But then I've trained myself to catch in that moment and be like, you know what? I don't know this person. I don't know what's going on in their life. And I'm just going to choose to believe the best about them, that they didn't cut me off on purpose. And hey, God bless them. So to me, that is controlling my thoughts. It's choosing to think differently about that person, right? Choosing to change, actively, consciously change what I think about a person or about a situation or circumstance. So are we talking about 2 different things when you say you can't control your thoughts?
No. So this is a perfect question, which I'm really glad you asked it. So, okay. So you did exactly what I just talked about. So with neuroplasticity, it's awareness, reframing, separation. So the term we use is reframing. And so that changes the input, right? So you control your body's physiology by changing the input. So, we might want to do another podcast on forgiveness. So forgiveness is too big of a word. So we've broken forgiveness into anger processing of dealing with the input, the nervous system, and the output. Because remember, anger is just a really fired up physiological state, right? So what you did, you felt it. And again, so you've done it so much, it just takes a few seconds. Whereas 5 years ago, I might have taken a little bit more time to actually say, okay, not worth it. Not going to ruin my day. So to me,
I wouldn't have even done, right. I mean, my former self, I would have just been pissed off for a while and then gotten distracted and moved on with my day.
Right. So what happens so with repetition, what's happening is you become so good at it, it becomes automatic. And that's where it's so, I'll use the word easy. So you already know, God, why do I want to give this jerk my quality of life? Or a lot of people hold on to their abuse from the past. So I'll talk about forgiveness just for a second. So we call it flipping the switch, which is different than positive thinking. So positive thinking would take some energy saying, well, that person may have a bad, I mean, it's all things you can do to say, if things are bad, they're bad. So what happens, we call it flipping the switch, is that anger is powerful. Nobody ever wants to give it up. You're not going to go away. So you had the thought, what a jerk. Okay, so that's, if you suppress that thought, that's where the control comes in. So what you did, you felt the thought, you separated, and you just went a different direction. So that's neuroplasticity. Does that make sense?
Mm-hmm. Yeah.
So what's doing it, I'm guessing over time that you become better at it, quicker at it, and then eventually you just don't get triggered a lot of the time at all.
So I guess what you're saying is, when you say you can't control your thoughts, is you can't control that initial thought, those initial thoughts, but you can reframe.
Correct.
Yeah, totally. I think that makes sense to me. And I know we just have a few minutes left, and I'd love to chat about COVID with you, since you brought it up. And I didn't know you had some papers, which I'm excited to dig into.
Right.
But when this stuff first started happening, in March 2020, I was very vocal and expressed concern, because 15 years, whatever, in the cancer world as a patient advocate, I knew how powerfully destructive fear is. Right. And patients are rushed into treatment out of fear. And I know fear suppresses your immune system. Fear creates inflammation. And so I saw this fear mongering happening, and I'm like, this is not good.
Right.
This is really not good. So what was your perspective?
Well, we wrote 3 papers. So plan A is that there's 12 categories of things that lower your inflammatory markers. So we're not even sure there's what's called a cytokine storm, which is inflammation that goes over the top and you die. So if you have lower inflammatory markers to start with, we think it's a normal cytokine rise to kill the virus and move on. So if you start with lower inflammatory markers, you have a higher chance of surviving. And of course, indeed, what we now know that every risk factor for a poor outcome is inflammatory. So again, hypertension, obesity, diabetes, all these things are inflammatory. But what's also not talked about in the press is anxiety, depression, fear are also inflammatory. So again, there's 12 categories in Plan A, which I'll send to you, that if you start out with these in the first place, it really is a call to health for the medical care system, because we're used to treating just the symptoms or illness. And every one of these risk factors for poor outcomes actually is preventable. That's what's tragic.
Right.
The people that are dying have preventable problems. So that's the elephant in the room. So then we have wrote another paper of how to actually treat COVID. And our frustration right now is that using the very model that we talked about today, that you prepare your body for battle. In other words, you're going to put gas in the car before you drive it. So there's a bunch of things you do prepare for to maximize your immune system, and we won't go over those now. So it's preparation. The second thing is recruitment. You recruit your body's own inflammatory processes, like, in other words, humming, certain music, calming techniques, massage, all those things calm down the nervous system because you're stimulating the vagus nerve. So you're recruiting the body's own defense mechanisms to heal. And again, the same thing is with cancer. It's the same deal. And then the final phase on the long hauler syndrome is the same problem with every chronic disease. Is chronic elevation of inflammatory markers. So there's all this discussion and billions of dollars spent in research about what's long hauler syndrome. It's all, as my friend says, it's all the same soup. Chronic elevated exposure to fight or flight. So as far as threats, poverty, financial issues, inequities, racism, lack of opportunity are all societal threats that create the same inflammatory response. Your brain being on fire, hyperreactive, could create the inflammatory response. And so all these diseases that are pre-existing factors are actually the same disease. So our work group is going to write down to the mitochondrial level, which is the engine of the cells. So Dr. Navio, again, I'm not the guy. I'm just the guy helping people scrub the data. It's been there for a long time. But he's taken the 13 chronic diseases that he's documented, and as he goes through it, there will be more, right down to mitochondrial dysfunction. All these diseases have the same sequence of the mitochondria breaking down. They release what's called ATP into the cellular tissues, into the extracellular tissues. Turns out that this thing called ATP, which is one of the fuel molecules of the cell, when it's inside the cell is a fuel source. When it's outside the cell, it's inflammatory. Or Steve Cole out of UCLA showed that social factors create inflammatory processes. They create what's called warrior monocytes. So these are monocytes. So monocytes are white blood cells that destroy viruses, bacteria, and cancer cells. And so they not only destroy viruses, bacteria, and cancer cells, they destroy your own tissues. So again, the two factors that determine this inflammatory response, and again, he's gone right down to the genetic code, to the DNA, and the DNA under social isolation produces warrior monocytes. But the other thing is chronic stress. So it's not the high-grade stresses that come and go, but that chronic low-grade stress fires off these warrior monocytes that directly destroy your tissues. So the solution, by the way, is essentially anyway. So it's a sort of so the Plan A and the long haulers treatment, by the way, is the same. And you'll recognize really clearly that this what you've already done. And then what we're trying to do, our frustration is we send it all over the country, all over the world, and we aren't getting physicians to listen to us. So it's actually just honoring the body's physiology. It's deeply data-based. And again, right now, medicine's ignoring the data, hence aggressive spine surgery on a physiological problem. So if you want to talk about the COVID in detail at some point, it's the same treatment plan as for every chronic disease. So how the COVID protocol came out is we started a chronic disease discussion group. And as we started talking to each other, we realized it was the same approach as treating COVID. It's multiple pronged. You maximize every part of the body's own defenses. And we feel very strongly that this pandemic is actually solvable. But using the same tools for you. My friend D.R. Clausen, who's just a genius, and he'd be wonderful to have on your show, he has very, very, very strong thoughts about cancer, that he thinks we're actually using chemotherapy to actually compromises your defenses, not recruit them. And what we're doing in COVID, for instance, we use steroids. Well, guess what? Steroids increase the glucose, which viruses love. In ketones, which is also an inadequate fuel source, actually viruses hate ketones, and they're anti-inflammatory. And so instead of giving ketones at the end of the care, we give glucose and cortisol, which cranks up the fuel for the viruses. That's just one example of how we're actually going against the body's own defenses. So again, I'm guessing in your situation why you have learned to actually marshal your own body's defenses. And guess what? You're doing fine. I think your story to me is incredible. And so,
thank you.
Yeah, I think it's fantastic. So you're illustrating exactly why I quit medicine. This is not alternative medicine. Again, I use the term disintegrated medicine for mainstream medicine. We're treating just symptoms. And integrated medicine and functional medicine are actually really mainstream medicine.
Yeah, it's a holistic approach. You're looking at the whole body, investigating and identifying the root causes, helping educate patients in how they can help themselves heal.
Right. It's deeply based. I mean, it's all based on extremely deep data that modern medicine is simply not acknowledging.
And it's hard to monetize those the things that you and I talk about, right? It's you can't bill insurance for it, really,
right?
And you can't patent it and sell it to billions of people,
right?
And therein lies the rub.
Yep.
Well, what I brought up earlier, I love the fact that you and I were doing the same things, because in the beginning of the COVID, pandemic announcements and all this stuff, the first things I did was to remind my audience that there's a lot of things you can do to strengthen your immune system. Let's focus on what we know, right? You need a strong immune system if you want to prevent cancer or heal it or prevent any chronic infectious disease or condition. We got to focus on strengthening your immune system, lowering inflammation. It's the same process, right? Yep. This may be a novel coronavirus, as they say, but the immune system is not new, and it is not going to start working differently, And if you are in a state of, if you're obese, you got heart disease, high blood pressure, diabetes, kidney problems, if you're in a state of poor health, you're going to have a compromised immune system. You're going to be more vulnerable to chronic infectious disease or infectious disease. So it's the exact same message that you're putting out there to your audience that I have been too. It's like, listen, you don't have to be afraid of this, but if you really want to protect yourself, you got to make sure that you're taking care of yourself. And there's very obvious science-backed methods and practices that you can incorporate into your life.
Right. Right.
You know? So I just had a big issue, and I still do, with the fear mongering because it is so immunosuppressive, and it's creating, we've basically just seen this worldwide heightened state of fear, anxiety, worry, depression. We don't trust each other. Now, you mentioned the threat response. I mean, there was a point now, and I feel like maybe it's better, but there was definitely a point in 2020 where everyone perceived everyone else as a threat.
Well, right? Guess what? They actually were. I mean, you have a choice of reacting to it. So yeah, I mean, you take precautions and do your thing, but you have to, it's a complicated answer to that, because the reality is, if you are somebody around with somebody with COVID, they actually are a threat and you actually are at risk. So you have to acknowledge that, but you have to get back. It's like the same thing. You can't get into positive thinking, which suppresses negative thinking. So, okay, this person's a threat, but I'm not going to be the mercy of that. I'm going to do what I need to do to keep myself safe, whatever that is. You decide to take a certain amount of risk, but whatever you do, you learn to actually lower your inflammatory response. You learn to lower this thing we call fear and anxiety by lowering your inflammatory markers. So you can write about it, you can do breathing, you can do diet and exercise, all those things lower inflammatory markers. So nobody's asking you to get rid of your fear, but you process it differently. So that's one reason I really strongly recommend people quit watching the news, for the exact reason you're talking about it. Because talking about firing up your immune system or firing up your inflammatory response, there's really nothing helpful about hearing the news. For example, fear of pain actually increases the pain. Why? Because it's inflammatory. And we know chronic pain is an inflammatory disorder. So if you elevate your inflammatory markers, you actually physically feel the pain more, because your brain's throwing off glial cells, your glial cells in your brain are throwing off inflammatory markers. So the inflammatory cytokines or proteins in the brain are actually fired up. Then your peripheral nerves that are conducting to the brain are increasing nerve conduction. So fear of pain actually increases the pain. Same thing, fear of cancer, fear of COVID, all these things, exactly as you pointed out, it's not psychological. That fear response actually activates your whole system. And the thing, I don't know how to convey this, and maybe you do this better than I do, but people talk about, the immune system, whatever. It's, if we didn't have an immune system, we wouldn't remotely be alive. I mean, what people don't understand, that the number one factor that physicians have feared since my early medical school days is infection. So we use antibiotics, again, to treat the symptoms, but again, we're not treating the immune system, right? So you knock down the infection, antibiotics are a miracle, but we're now getting more and more resistance to antibiotics. So we think that COVID's bad. The most common bacteria is Staph aureus. It's a skin bacteria. It's by far away the most common. What the world doesn't know is that we started using antibiotics indiscriminately, again, treating symptoms. We used too powerful antibiotics too long. Then we developed resistance after resistance after resistance. So right now there's a new strain of Staph aureus. Again, the most common bacterial infection there is. We're down to one antibiotic for it. So as that starts to come in place, the epidemic of staph infections and death is going to be horrible.
When that last antibiotic stops working.
Well, right now, that last antibiotic is about $30,000 a month.
Wow.
So we don't even really have, it's not very common yet, but in 1999, when I left for Sun Valley, Idaho, where I worked for 4 years, about 10% of infections were called MRSA, MRSA, methicillin-resistant staph. When I came back to Seattle, 50% were MRSA. Now, I don't know what it is today, but when I was a medical student, we never heard of it. So there's penicillin. Then first it was penicillin resistance. First of all, the staph was responsive to everything. Anyway, I'm just saying that I think we're trying to convey the same thing, is that this thing called the immune system, we go, diet, exercise, it's life. I mean, look at your gut. Your gut has more bacteria in the gut than you have cells in your body. So the human body exists because we created a truce with the environment. So the bacteria actually digest our food. It creates melatonin and serotonin. A lot of the neurotransmitters come out of the gut. So the way humans evolved, we developed a truce or working relationship with bacteria. So every day you have bacteria in your bloodstream, you have viruses in your bloodstream, you also have cancer cells in your bloodstream every day. So your immune system picks them off every day. And so when your immune system gets compromised, it's not that the cancer cells just came out of nowhere. Your body has to defend itself against this stuff all the time. So you're so dead on with what you're doing, and it's so critical. And I just want people to understand how critical this immune function is. And people say, well, I eat healthy, anti-inflammatory diet, et cetera. It doesn't seem to help. It does help. Again, there's other things to do. So if you're eating correctly, but terrorized by fear, your inflammatory markers are still up. So remember, the solution is always a multi-pronged approach. So sleep, diet, exercise all help. Mindfulness meditation help. Processing your fear, like we talked about, helps. So it takes a full approach. That's why there's 12 different areas of intervention that help your immune system. So I think the problem is people look at one intervention as a solution, and that's not the case. But and let's take it away from the immune system. Just saying you're giving your total body the opportunity to take care of itself is really the key issue. And so, and again, your story is compelling, and that's my patients that get better from chronic pain also reverse their autoimmune disorders. All sorts of stuff starts happening because your body's functioning better.
Well, what you said is something that I echo to my people in my community all the time, is that, you can do all the physical things. You can do everything right, the diet, exercise, therapies, right? But if you don't address the stress,
right,
you may not get well. If
right.
you don't address the mental, emotional, spiritual stuff in your life, because in my opinion, that can outweigh, and I think you probably agree, that can outweigh all of the good physical stuff you do for yourself. And so when you were saying, well, people said, I'm eating an anti-inflammatory diet, it's not helping. It's helping,
right?
But it cannot, it's not enough if you're still, full of fear and anger and bitterness and resentments and insecurities.
Absolutely.
And if you're just a swirling mess of negativity, you gotta deal with that.
Right. But I think your audience probably already knows that, because again, I'll just reinforce it again. So you have all this negativity in your brain. People don't translate that into what's happening to your body's physiology. That's the key. I mean, this is not just psychological out here. It's your body's physiology over here.
It's not isolated between your ears.
Right. It's exactly. And then again, I look at the body as a unit response. So, I mean, I just want to summarize this one more time. So every living organism, from bacteria to humans, avoid threats and they gravitate towards safety. It's how we survive. There's no shortcuts with that. So the three parts are the input of your stresses or your circumstances, physical or mental, societal or personal, doesn't matter. A threat is a threat.
Mm-hmm.
Then you have the state of your nervous system, that if you come from a chaotic, abusive childhood, you're programmed to be on high alert. It's like a feral cat compared to a domestic cat. So there's things you can do to address the nervous system. So then there's your final physiology, either safety or threat. So the way you minimize your time in threat physiology, you can directly lower the markers, you can increase the resiliency of your nervous system, and you can't avoid threats, but you can process them in a way that does not have as much impact on your nervous system. So if you have less impact on your nervous system and your nervous system is more resilient, then you have less time in threat physiology. But in summation, the essence of healing is minimizing your time in threat physiology and maximizing your time in safety. And there's lots of ways of doing that.
This has been an amazing conversation. Thank you so much. I want to make sure people know where to get your book. The book is called Do You Really Need Spine Surgery? And it's not just about spine surgery, although the book has a lot of, if you want to learn all about your spine and spinal health, it's in there. But there's more to it. Obviously, like what we've discussed now, is going into understanding stress, how to deal with it, how to get your body out of that stressful state into a state of rest and peace. And I'm just so excited about sharing this interview. And thank you so much for what you're doing. This has been really, really fun, really informative. One more quick question, because I'm curious. Do you suggest that someone do this writing practice when they are triggered? Is there a trigger for it, or do you just suggest people do it a couple times a day and it doesn't matter when?
So let me say one final thing. Just we decided that it takes multiple pronged approach to actually solve disease, right? So expressive writing is only one step. It's not going to solve the problem. So again, this is called the DOC journey, direct your own care journey. And it starts with the sequence of getting some basics started and practicing with repetition, learning some basic skills. And then I urge people to use it maybe 15 minutes a day and actually start just training your brain over and over and over again. So the doc journey represents it. I have a website, backincontrol.com, this massive repository of blogs and stuff, which actually worked for many patients. But the doc journey is a sequence that's very specific now that represents people that have healed. And by understanding the relationship between the input of the nervous system and the output, people understand it much quicker. So I'm pretty excited about it. And so I just would say that whatever way you do it, understand that you understand the problem first. And by the way, the doc journey starts with embracing your skepticism. Does this make sense to you? I'm just curious from your perspective, because it's not about positive thinking. It's about actually digging into the negative thinking and actually moving forward. Okay, this is where I am. I'm not very happy about it. And how do you find your way out of it? So this is not about believing the doc journey. It's not about believing David Hanscom or Back in Control. So people think they just generate enough belief in my process, they're going to heal. It's actually the opposite. So it's actually embracing your disbelief. I mean, why would it work? You've tried everything. You've been promised the world. Why would this work? So if you come into this thing, I'm really excited about the doctrine, I'm going to get healed, I should say, look, stop. Just do the work, dig in. And you can't fix your brain, but you can allow your brain to heal. And I'll say your body to heal. And then it's game on. So it's a long answer to a short question, but just doing expressive writing it's mandatory. It's a starting point. And then there's just layer and layer and layer that is actually not very hard to actually layer on top of that.
So where can people get started on that journey?
So it's called the docjourney.com. It's like $25 a month, but it's also a 2-week free trial. We also do a twice a week question and answer period session, which has been wonderful. We do know that a sense of community actually induces oxytocin, which is very anti-inflammatory. So between the sequence on the doc journey and also the group sessions, this has been a wonderful experience for me. I mean, so I quit my practice. I'm seeing so many people get better. I'm not, and so many people being damaged with really bad spine surgery. So I'm watching people, as you learn to negate these anxiety, anger circuits, people thrive at a level they did not know was possible. And I'm guessing that's your experience too.
And I'm sure you're hearing reports of not just people who are their backs don't hurt anymore.
Right. Yeah. No, my 17 symptoms are, every one of them's gone. No migraines, no tinnitus, no burning, no rashes, nothing. They're all gone. But as my body chemistry is normalized, people say, well, that's crazy. That's snake oil. Not true. If your body chemistry is off, each organ system is going to respond in its own way. That's why there's over 30 different symptoms of a fired up nervous system. So I'm fine. I mean, my wife might argue with you whether I'm fine or not. That's a different topic. But no, physically speaking, I don't have anxiety. I don't have OCD. I don't have depression. My ears don't ring. It's unbelievable. I never expected this. So I'm excited to be able to, it took me 15 years to figure this out. Now, say the last 2 years, I finally understand the neuroscience better to convey it more clearly. But only 20% of physicians are comfortable managing chronic pain. Only 1% enjoy it. And it's been the most rewarding phase of my career, as you can tell by far. By the way, this is about chronic disease, not chronic pain, right? We just talked about a whole range of things. So chronic pain is one of the chronic diseases, but really the principles address chronic disease. And that's where I'm really anxious to find out your journey and find out. Anyway, I'll learn from you as far as what you did, because everybody does it their own way. That's why it's called direct your own care.
I love it. I'm looking forward to being on your podcast. And okay, so I just want to make sure that the docjourney.com,
right,
if people want to really dig in and start this using these tools that you've put together to help reduce stress and activate your parasympathetic nervous system and just get in that, and start the healing process. I mean, that's
Yep.
really what it's about. And then also the website you mentioned earlier was back.
So I have a bunch of, I do a blog every week. It's on backandcontrol.com, one word.
Backandcontrol.com.
Yeah. And the book is called Back and Control, a Surgeon's Roadmap Out of Chronic Pain. And again, it's not a self-help book as much as a framework. In other words, as you organize your thinking, then you can start addressing your situation very methodically. And so the book's a great background to get the whole process started. So it gives you the framework, and then you learn as you learn the tools, you learn how to apply them to you, because your approach, you're not me. Your life is different than mine. So by definition, the only way you can heal is by taking control of yourself. So you can't heal yourself. You can get out of your own way and allow yourself to heal. That's sort of the key issue here.
I love it. Okay. Again, Dr. David Hanscom, thank you so much for your time. Looking forward to connecting and getting to know each other better. And thanks for watching, everybody. Please share this video with people you care about, especially those in your life with back pain or chronic disease problems, because the root cause of chronic disease, many chronic diseases, arguably maybe all, is stress. And this is just an incredible man and resource that more people need to know about. So please share this video. Thanks for watching, everybody.